White House is considering dissolving 9 outside expert advisory committees for the CDC that help with major issues such as bird flu and HIV. This is according to a series of emails obtained by Politico recently, and I'm going to list for you the 9 advisory committees that they may be removing. The Clinical Laboratory Improvement Advisory Committee, the CDC/HRSA Advisory Committee on HIV, Viral Hepatitis, and STD Prevention and Treatment, Board of Scientific Counselors, National Institute for Occupational Safety and Health, Board of Scientific Counselors, Deputy Director for Infectious Diseases, Healthcare Infection Control Practices Advisory Committee, Disease, Disability, and Injury Prevention and Control Special Emphasis Panel, the Board of Scientific Counselors, National Center for Health Statistics, Safety and Occupational Health Study Section, and the Board of Scientific Counselors, Center for Preparedness and Response. The Department of Health and Human Services, in their initial email to CDC leaders, said that they had until 10 p.m. last night to justify why they should keep these advisory committees when they're not required by law, but then in a second email said that there was no response required at this time. There are other potential cuts looming, according to CBS News. Multiple sources are concerned that there may be steep layoffs at places like the CDC, FDA, NIH, and something called the AHRQ, or Agency for Healthcare Research and Quality. I am intimately familiar with that organization because they do a lot of work collecting and analyzing data regarding hospitalizations. And one of the first papers that I published in 2018 looked specifically at children with something called primary immunodeficiency diseases in the hospital setting. And I had utilized one of their databases in order to come up with some important conclusions. I don't know how we're going to be able to function from a public health standpoint if these cuts continue.